Meg Laporte with the Maryland Regional Direct Services Collaborative, and just a couple of housekeeping items. Please feel free to turn your camera on if you'd like. If not, no big deal. Please mute yourself, and we will have a chance for Q&A, we hope, at the end. And please feel free to say hi in the chat. Put your questions in the chat as well, if you don't mind. I'd appreciate that. Again, I'm with the Maryland Regional Direct Services Collaborative. We are a network of organizations and individuals committed to improving job quality and facilitating the advancement, recruitment, and retention of direct care professionals in the Maryland region. This is the second in a series of 4 webinar events that we are hosting thanks to a grant from the ABLE Foundation. These events will include, this series will include 2 issue briefs and a final report. And it is really, this work really is in follow-up to a report that was published in about a year ago by the collaborative on Baltimore direct care and services workers. And I will share this PDF, the PDF of the presentation with everyone, and we'll have a link to everything. There will be links to it too. So I just want to start with a little bit of framework around the discussion today. And some of you know, many of you probably know an organization called PHI. They do a lot of great research and thought leadership in the area of direct care and services. And so I wanted to point out that about 4 years ago, they published something called, oops, excuse me, how did I lose that? They published something called the 5 pillars of direct care job quality. And I'd like to have my crude little circle around one of them, of course, is respect and recognition, which is relevant to our topic today, of course. And as you can see on some of these, the bullet points, some of them they discuss opportunities for direct care workers to influence organizational decisions, direct care workers empowering direct care workers to participate in care planning and coordination, and more. So also just about a year ago, the National Association of Healthcare Assistants published a survey, the results of a survey. They had just over 2,000 responses. And in order, these are the responses to the question about what challenges are you facing in your job right now, if any. And one of them, of course, was lack of appreciation and respect from supervisors. Finally, there's a survey that we did as part of the report when we were preparing the report for ABLE, the report that we published a year ago on Baltimore direct care and services professionals. And as you can see, the 3rd most popular response to what would it take for an employer to hire you back if you were thinking of leaving your job which is, I think, pretty relevant to this discussion: positive culture or morale among staff. And I just realized that there's a typo there and I had the wrong word. Anyway, so I'm going to stop sharing here. I'm going to show some slides later. So without further ado, I really just want to launch into our first panel, or it's going to be with direct care and services professionals. So thank you everyone so much for joining. And I'd like to start by asking Reba McKinney is on with us. We have, I think, 4 or 5 other direct care professionals with us today. And Reba, if you could just sort of give an overview of what we talked about before when we were preparing for this webinar, and talk a little bit about what your experiences have been with appreciation. You've had on both sides. You've had not so good, and you've had very great respect and appreciation. So I'd love for you to talk about that.
Good afternoon, everyone. My name is Reba McKinney, and I was a CNA, GNA for about 21, 22 years in long-term care, but I am now an administrative organizer. So for me, I have experienced both sides. I spent 14 years with a company that was absolutely amazing. The level of respect that management and our supervisors gave was above and beyond. It was a type of employment where we felt like family. We had administrators and directive nurses that weren't afraid to help out on the units. They understood and heard the voices of the workers instead of always making it seem as if everything that we do is wrong. It was Um, they gave so many, we had proms that included residents and the employees where we could dress up and attend the proms with them. We had carnival days where they would bring out the grills and we would do hamburgers and hot dogs. We had mock weddings, you know, so many activities and things that went on. Employee of the month, employee of the year, free parking spots. Um, if you had a unit that didn't have any falls, you were given a gift card. Just little small incentives. Holidays, we had holiday parties, which were amazing. And that was one of the cultures that I was actually used to because I spent my first 14 years of nursing at that one facility. And I spent 14 years there because of the type of environment that I worked in. I wanted to come to work. I loved coming there every day. I did my regular shift overtime. If I was asked to stay, I didn't have a problem with it because we worked together and it felt like a family and we felt appreciated. So to move on from there, I actually went to another company because management came over in there and it changed the complete dynamic and morale of the facility. I went to another company where I stayed for 11 years. So for me, I have longevity. I'm not one that like to hop around to jobs because what I do is what I love. It's not about the money because we know that they don't pay us enough to do it, but it's the love and compassion that I had for my residents. So I spent 11 years at another company that was previously owned, but taken over by someone else. And the morale changed completely. The previous owners was amazing. Again, it was another facility that felt like family. We were connected. I loved coming to work. The residents, they really looked out for the workers as well as the residents. So it felt like I was going back into what I was used to. A new company came in and took over and it went completely to shambles. The morale and respect in there changed. We were talked at instead of talked to. The staffing ratio, they came in and changed that, which really made the workload absolutely heavy on the GNAs to resident ratio. Um, the level of food that the residents were used to changed to the point where now we're having family members and residents complain about those things. They started complaining about the interaction with management. They didn't come on the units. They didn't say hi to the residents. They didn't introduce themselves. You have management that will walk right past you and won't even speak. Family members feel that negativity as well because if you're the head of a facility, it starts at the top and it trickles down. So if this is what you're bringing into the building, this is what the family members are seeing, this is what the residents are seeing. So this is what the employees are enduring. There was no incentives of, oh, well, your unit didn't have any falls today. There was nothing given. Pizza parties, we always just get slices of pizza and chicken. Well, I'll tell you one thing, I don't look like I'm missing a meal. So my appreciation doesn't always have to be a slice of pizza and some chicken wings, something as simple as maybe a gift card, because that way I can probably get gas to get to work. Or I can use that gift card because holidays I like to buy my residents gifts around Christmas time. That could have been something that I used to go towards that. So respect goes a long ways when you're in the workplace because it sets the tone of your day. When you walk in and you walk into the negativity that you're given by your management, it really puts you in a bad space. You don't feel comfortable having conversations with management because there's always that you're wrong, you're wrong, you're wrong. So the level of respect and professionalism honestly goes a long ways when you're dealing with residents, when you're dealing with family members, and when you're dealing with staff, because at the end of the day, we are all human beings. We all have a job to do, understandably, when we clock in, but we should not be spending an 8 or 12-hour shift feeling like we're walking on eggshells because management does not give respect.
Thank you so much for that, Reba. Are there some other ways in which you could give us some examples of respect, other ways that you received or saw or experienced respect from your coworkers and your supervisors?
Well, for me, with respect with my coworkers, we make it a big thing to talk to each other, not at each other. That's number one. If we're experiencing issues on our unit, we don't always have to go to upper management because we can go to each other. I can explain to you what I saw when I came in behind you the same way I would want you to come to me. So it makes the work environment peaceful because we don't always have to take everything to upper management if we all can work together collectively as a unit. So we're able to problem solve pretty much on our own. And when you do things like that, it makes the work environment from employee to employee more enjoyable because I know that I don't have to go to HR every time something is done because I can go to my coworker and I can express to you what may have happened and we can fix that. There has been times where us as coworkers, we put together and we do donuts and coffee for each other. Something so simple as that, just to show the I thank you or I appreciate you for the work that we do amongst each other.
So it sounds like the respect and appreciation you receive from the leadership at the also had an impact in how you treated each other as well.
Absolutely.
Excellent. So Rachel or Tanya or Jackie, do you guys have any other experiences you'd like to share?
Hello.
I'll let her go.
No, you can go ahead. I can wait. Go ahead.
Okay, can everybody hear me? So with my experiences, I've been, I'm a CNA or was a CNA, GNA, I'm a CMT now. I had a lot of experiences throughout the years. I've been doing this for probably like 10, 11 years. Initially when I did my CNA, GNA, I think when I was exposed initially to the world of a nursing home, it turned me off a lot by seeing how the place that I worked at treated the residents. And for me, a big thing is how we treat the residents because that's what we're there for, and then and each other and upper in the nursing world too, like management and everything. After that, I did go to a private facility and I had been there for 10 years. I was at the nursing home for one. And after that, I was turned off by nursing homes. So I decided I wanted to do assisted living. And that's where I have been and planted my feet in assisted living. I did that for 10 years. I've been doing that. The place that I worked at previously, I feel like my job there is I went in and I cared for my residents and I treated them with respect and how I would want to be treated or my family to be treated and let them know like they're still human beings. And with that place, a lot of the people there, they kind of just wanted you, they're very negative. And that was the hard part. And they just wanted to push you to do more, 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 which was difficult for me. And I did end up leaving there. And now I work for Heather and under Heather at Copper Ridge, which I have seen a huge difference with working at Copper Ridge. And honestly, it's been a huge relief of having a manager that understands and she'll get on the floor and help you. And she will want to discuss everything with you and is very open to like, hey, what's going on? Like, what do we need to do? And she's big on communication, which I feel like is very important in this field also. We all should communicate, for our residents and for each other and be able to do that, just like the last lady said. So that's what I have to say. And my experiences with it.
Thank you very much, Rachel. You mentioned that you said Heather will get on the floor with you and help you out if needed. And yes. I think that I'm going to guess that's probably another show of respect, right?
Oh, yeah, definitely.
Is able, if there's somebody she doesn't have to, I suppose, but if she knows that it's needed and the help is needed, she has no problem doing that.
Yeah. So. And then even the other day, it was just me there at the moment and I could have gone and gotten a coworker, but Heather was like, hey, I'll help you, and it wasn't the ideal situation to go help with, but she did it and she did it with me and she didn't, and it shows that like, hey, I'm not too good to be able to help you and show you like I'm here and I understand too, because she's done it before as well. And I've been with Heather for years. We've worked together. And I respect her. And I think, she's been doing, and it shows how a manager should treat their employees, which I appreciate that.
Thank you so much, Rachel. Tanya.
Hello, can y'all hear me?
Mm-hmm.
Okay. I'm Tanya, and I'm an at-home PCA, so I'm an at-home care provider. So my experience is completely different from everything that just had been mentioned. There is no respect and there is no compassion for the people that do in-home care, in my opinion. I've been doing this type of work for 14 years. I've been with the same company for 14 years. And in those 14 years, I've had 3 clients. The only way I leave a client is if a client passed away. I had 2 clients pass away, and the client I'm with now, I've been with him for 2 years. As I said, there's no compassion, no anything for people who do my job. For instance, my grandmother passed away. They wouldn't even give me the day off. I had to take the day off without pay. Just the one day for the funeral. I couldn't take any other day off. I could only have that one day off. 2 weeks after that, my uncle passed. The same thing. I lost a best friend. They wouldn't give me that day off at all. I had to take a break from work to go to the funeral and come back to work. So there's no compassion or no respect at all. I do a lot of running for my client because my client, he's bedridden, so he can't get out to bed, so he can't do anything for himself. He depends on me for everything. As far as going to the market and going to the stores and stuff like that, there's no compensation for gas or anything. All of that is on me. I'm already paying $200 every 2 weeks to get back and forth to work and for my client's care, not to mention my paycheck. I'm going to tell y'all some stuff that y'all probably not going to believe. My paychecks are only $888 every 2 weeks. So I'm not getting paid. So I'm not getting paid much money, but out of that, every week, I'm taking $100 for gas to get to work and to run for him. And I do 50 hours a week, not 40. I do 50 hours a week. I do 5 10-hour days with him.
Wow.
And then when I talk to an employee and say, well, can I get mileage or something like that? Oh, we don't offer that. Oh, the state not gonna let us pay for that. No, you can't have that. That's all I get. So there's no compensation, no compassion or anything for people who does the type of work I do, and I don't think it's fair. And the only reason I still do this work is for my client, because I have a heart for him, not for the pay, not for the company or for any other reason, but for the client, because I know he depends on me. And nobody's going to treat him or love on him the way that I do. That's the only reason why I still come. But there's no compassion. There's no thank you, no nothing. I get nothing. But I'm expected a lot. I'm expected a lot. Thank you. I'm in a meeting. Thank you. But I'm expected to do a lot. And I get nothing. I don't know anybody else who works for the company because they never have any gatherings, so co-workers can meet each other. So it may be somebody else here who works for my company, but I wouldn't know because they never have anything for us to get together. So I don't know. We get no thank yous, we get no compensations, we get nothing. All we get is a paycheck, which is less than adequate for anything. I mean, because think about it. I'm in the market every 2 weeks making life decisions. Do I buy food so I can eat, or do I get gas so I can go to work? How many of you all function off of $888 every 2 weeks? Not to mention rent is $1,000. Wow. Then I got car payment. Then I got insurance. Then gas, $200 every $100 a week, which is $200 every pack. And I haven't paid anything else yet. I haven't paid my phone bill or anything. But yet they expect me to keep coming to work, keep smiling, and keep doing it. And we get something for them. I do it for the client. That's the only reason I keep doing it, is because I have a heart for him, because I know he depends on me. Is it fair? It's not. But how fair would it be for me to leave him now?
Thank you, Tanya. That's pretty amazing. And I'm sorry to hear about I'm sorry about all of this. You said that you stay for your client. I presume that you have a good relationship with your clients, and that I hope they show you some appreciation as well, or at least they show you some appreciation, and that you get recognition from your clients.
I mean, yeah, every now and then, they say thank you and stuff like that. But I know that they depend on me. Like I said, the client I have now, he's bedridden. If it weren't for me, he wouldn't be able to eat. He wouldn't be able to drink. He has a colostomy bag. He wouldn't be able to do anything because he can't get out of bed.
Wow. Wow.
And then the company I work for, they just expect you to keep on coming and get nothing. But then when you call and ask them questions, They want to give me attitude. What you giving me attitude for? I'm out here doing the work. So it's not easy, but at the same time, like I said, I keep doing it because I have a heart for my clients.
Thank you, Tanya.
Even though it's hurting me in the long run, because it really is.
Clearly you have examples of what not to do. And I very much appreciate your input. Thank you so much. And Jackie, would you like to talk about
Yeah,
your experiences?
yeah. Hi, my name is Jacqueline. I've been with my company for 16 years now. When I started working here, it felt so good. It feels like it's a home. All when you come to work, your co-workers and everyone happy. So we work together. We work together as a family. That's why I've been here so long. And the residents too, they appreciate everything we do for them. I know some days might not be the same, but the boss will tell you if you have issues, leave it at the door and then come in and do your job. When you're going back home, pick it up and go. So we did that and the job was really good. Oh, okay. So I like what I do. That's why I'm still here.
Mhm.
It's a good place to work. Even though the pay might not be good, but I always feel like do your best and the appreciation will come from somewhere. The pay is not good everywhere. I haven't been to different places that I know it's hard. Our job is not easy. It's not an easy job. I've worked long-term, short-term dementia units, and the abuse that we get from the residents, we just laugh over it because I don't think they want to be here, but it's because of circumstances. That's why they are here. So we should put ourselves there and see how they feel. So each day you come in, just pray to God that you have a good day. Because if you keep listening to what they tell you, you might not come the next day. But take care of them like they are your parents that you're taking care of. Because we don't know where we are going to end up because it's not easy. And then nowadays, the GNAs that are coming, I don't know. I don't know. It's not easy. It's not easy. But I don't even know what to say. But my job is good. Where I work right now is good. They appreciate everything we do. The managements are okay. Our bosses, all of them, they are good. They are good. So I can't complain here. I thank God I have a job and
Thank you, Jackie. Is there something you can point to that you at your work where you actually feel like you are shown respect? Like are there any particular things that help you feel like you are respected?
yeah, they talk with us with respect. It's the way you talk to them too. If I talk to my boss with respect, my boss will talk to me with respect too. I know some days there will be a rough day, but it's not going to be every day. And they appreciate what we do. They come out and say, oh, you're doing a good job. And then the residents' family, they all appreciate us and all that. So I can't really complain that much because I know how I come in. When I come in, I say, I don't know, I come in with a good spirit, so I get it back too. Yeah.
And I know that you have been shown some very special recognition via the Sika Foundation. And I wonder if you could speak to that. What happened with that?
Yeah, it was just one fateful day. I was here working as I do, and a visitor came in. I don't know her, but she came in and she spoke to me. So I think the way I responded to her, she appreciated me and felt like this will be her home when she gets older. And I was really, really glad for that because as a visitor coming in and seeing what I do, I've been 16 years and no one has said that to me here. And a visitor coming to tell me this, I really appreciate that. And I keep talking about it every day. Like it was my angel, my guardian angel that came in that day. Because it's not easy taking care of the resident, but we do our best. If you don't have the patience, If you don't have the patient, this will not be your job. And me and my co-workers, we always talk about this. I say, let's be patient with the residents. We have to be patient with them and then get our day done. Yeah, so.
Thank you
I'm
so
grateful.
much, Jackie. We'll hear more about Sika Foundation in a little bit. Thank you so much. And I wonder if there's anyone else on who's maybe called in, another direct care professional who would like to say something about their own work. We have, I'm not sure if Cynthia's here, Kalia, or Josetta. I know that they were going to attend. If anybody would like to if you'd like to take yourself off mute and say something, that'd be great. I'll give it a few seconds. Okay, anybody else? Would you like to reiterate something, or Rachel or Reba? I think you're still here, but I guess she must have gone off the video. So anybody else like to just sort of bring up something that to drive home to the folks who are listening?
I think that all I want to say is like, I get where everybody's coming from, and I give credit to everybody in healthcare and CNA, GNAs and what we do. So just keep doing what you're doing, because in the end, how you treat people and the love you give them, you're not just making a difference to the company, but you're doing it in that person's life. And that's the rest of their life that they have. And it's you every day, so everybody just keep doing great in it. And for the lady who's having a hard time with her work, you are making a difference in that guy's life. So that's where you are gaining from it. Because to me, it's an important thing, and to be there for somebody, because they don't get that, like the normal everyday stuff, So that's all I got to say to add to it. Everybody keep doing what you're doing with it and show care,
Thank you so much, Rachel. Thank you, everyone. We really appreciate you being on this panel and offering your perspectives and your insight. It's very, very important for folks to know this. And I think that really, when it comes to the workforce crisis that we're dealing with right now, and recruitment and retention, these are very important components to understand about respect, appreciation, and recognition. So thank you. I'd like to move to our second panel, and that is we've got endurance, Elnaz, Heather, and Nate. And so I think we're going to go with you first, Elnaz, if that's okay. Do you want to share your slides? You should be able to share them.
Sure, yeah, definitely. Hi, everyone. My screen here. Are you able to see that? Everyone can hear me okay? All right, wonderful. So just a little bit about myself. So good afternoon. My name is Elma Safavi. I'm the Director of Caregiver Services at Family Nursing Care, excuse me. I came to Family Nursing Care a little over 3 years ago during the height of the pandemic, with a history of working in customer service and management, but in the banking industry. So I've kind of transitioned from banking to healthcare or home care. I started as a caregiver recruiter and then transitioned to HR. And now, as the director, I happily lead the caregiver services team, where I oversee onboarding, training, retention, and rewards for caregivers. So my team focuses on connecting with caregivers, helping them day to day from day one, leading the onboarding process, ensuring their certifications are up to date, leading in vital trainings, showing them what trainings, what resources they can use for trainings, and overall acting as an ongoing resource for them. So a little bit about Family and Nursing Care. We are the leading, Family Nursing Care is a leading resource for private duty home care services in Maryland and Washington, D.C. We were founded in 1968 by Sandy Kurzban, and we currently have a network of 1,500 plus caregivers, which is one of the largest in our region. Our success and longevity in the home care industry is closely tied to our history and our adherence and dedication to our shared vision and values. Our shared vision is to be the premier resource for home care services for older adults, dedicated to and recognized for our passion and commitment to serve, help, and enhance the quality of life and well-being of others. Our company operates on a set of guiding values, which we take very seriously and discuss every week in our all-hands staff meeting. Our chief amongst these values is recognizing the importance of a caregiver to our business, and treating them accordingly with great respect, with great importance and engagement. We make sure that we are trying to reward our caregivers for a job well done in everything we do. So just a little bit about how we do that. So it always starts with our onboarding and retention. So our recruitment team rigorously screens caregivers to make sure that they not only have the certifications and the skills needed for the job, but that they also share in our values and respect and love for aging adults. They are compassionate, reliable, and trustworthy. Only the top 8% of applicants make it through our screening process. Once they make it through the recruitment process, including a phone screening, competency exams, background checks, and a face-to-face interview, caregivers are then onboarded through our one-day orientation process. This one-day course introduces caregivers to family and nursing care, collects all necessary documentation, and then we discuss demonstrate the skills and demeanor needed to be a caregiver with family and nursing care. After that initial onboarding process, we work hard to maintain a great relationship with our caregivers. Each year, we celebrate caregiver milestones and anniversaries, and our list contains caregivers who have been with family and nursing care for 10, 20, and 30 plus years. We have a robust caregiver referral network program. So when our caregivers refer other caregivers to join, they do get, we extend a $250 referral bonus for them when they refer them. And as such, not just because of that, but because of how great our programs are and how much we value our caregivers, the majority of our caregivers that come through onboarding are from referrals from other caregivers who always tell us that it's a great company to work for. A little bit more about our caregiver engagement. As part of our adherence to our guiding values and recognizing the value of our caregivers to family and nursing care and what caregivers provide for the clients, everyone in our company has a role to play in the effort to engage with and recognize our caregivers every chance we get. So just some examples is we do get comments from our clients. These could be letting us know that caregivers are doing a great job. It could be through phone calls, client surveys, and a lot of times even handwritten letters that we receive. Whenever a caregiver is recognized by a client, we send the caregiver something called a Snappy gift. Snappy is a website, it's a reward website that we use. When a caregiver receives an email inviting them to visit the site and choose from a variety of available gift options. And one of the gift options that they choose will be mailed to their home. Another way we engage with our caregivers is by sending out birthday cards and anniversary cards to celebrate them every year. So we never let a birthday or work anniversary go unnoticed. We also have something called our Goodwill Committee, and we get together and send condolence letters, condolence flowers, and other personalized recognition to caregivers that are experiencing life events. So it's not just for condolences, it's if a caregiver gets married, sending them something to let them know we're happy for them, or if they had a birth in the they had a childbirth, we send them something to congratulate them as well. During the holidays, we conduct a holiday gift campaign where caregivers can choose from a selection of $50 gift card or an equivalent gift value. We had great engagement with this campaign. So in 2023, we had almost 1,400 caregivers that requested a holiday gift. And we always want to interact with our caregivers face to face. So every summer we do hold a caregiver appreciation picnic. All of our family and nursing care office staff members are required to attend, and caregivers are invited for food, fun, music, raffles, gifts, among other things. It's a chance for us to reward and recognize caregivers for all that they do, and for our office staff to meet and talk to our caregivers face to face and for caregivers to see each other as well. The other thing is we really ask for caregiver feedback. So not only do we engage with caregivers by offering them rewards and recognition, but we also value their feedback and take their concerns pretty seriously. We send out caregiver surveys annually to all of our caregivers, and we use the feedback that the caregivers share in the survey responses to inform us about what we are doing well and make decisions about things that we can do to make their experience even better. So each week in our staff meetings, we discuss one piece of the caregiver survey results to keep the caregiver's experience top of mind and continue to improve on it. In response to the feedback from our caregiver surveys, our directors of care coordination implemented a director's open hour series where they invite caregivers to join a Zoom session to discuss sensitive topics as well as share tips for caregiver success. So caregiver services holds monthly meet and greet for caregivers as well to give them a chance to connect with our staff and with each other. And caregivers are always welcome to call and speak to a live person on our caregiver services operations or nursing team to ask questions and talk and share in any comments and concerns. And because of all of the things that I've talked about, due to the final results of our caregiver survey, we are thrilled to have received the National Business Research Institute Circle of Excellence Award, which recognizes organizations for their outstanding achievements in customer staff and caregiver satisfaction. I'm pleased to say caregivers categorized 8 out of 10 of the topics addressed in the survey as strengths, with job satisfaction and interactions with office staff in earning the highest satisfaction ratings among caregivers. None of the topics that were categorized by caregivers as weaknesses or threats. 2 items scored above 90%, and those items were, I am proud to tell people I work with or for family and nursing care, and I overall like being a caregiver with family and nursing care. So this excellence in caregiver satisfaction is what we strive to achieve and why we work so hard to implement programs and practices to make caregivers feel valued and engaged from the day they join our orientation throughout their entire family and nursing care experience. And I really appreciated the opportunity to go over all of these items with everyone and hear other people and how you guys enjoy being rewarded and just making sure that we're doing what we can. So everyone is recognized. So thank you all. So Meg, I'll turn it to you.
Thank you so much on those. I appreciate it so much. We've actually just had 2 caregivers join us, so we would love to hear from them. I think we've got Kalia and Cynthia. So if you don't mind, if you could unmute yourselves if you're muted and let us know what your experiences have been, either good or bad, with regard to respect and recognition. I think Celia's.
Good morning. I'm sorry. Good morning.
Hi, Cynthia. Thank you so much.
Hi, I just took lunch. I'm sorry.
No, no worries. No worries.
Okay. All right. Can you please repeat the question for me?
Yeah. So just if you could share with us experiences that you've had in your work. First, just tell us too what your job is, what your title is, and what you do, and then tell us what you've experienced with regard to what good experience you may have had with respect and appreciation from your employers, or not so good. We just want to know.
Okay, so I'm currently a GNA CNA, and I work for Baltimore City Public School, and I do home care on the weekends, and I work at the nursing home on my days off. When like the spring break or something. Oh my God. Come on.
We can hear you.
Oh, I'm sorry. It's something else popped up on my screen.
Oh, okay. That's all right.
Okay, yeah. I'm sorry. All right. Something popped up on my screen. All right, yeah. So 1 second for me. I'm sorry, y'all. I'm trying to get myself together.
Right, we can ask Kalia maybe. I think Kalia joined. If you want to, if Kalia, you want to talk while Cynthia.
Yes, please do. I'm getting myself together. Yeah, go right here.
Hello. So
my who I am connected with, I have not had any problems with
So
the
Kalia, I'm gonna interrupt you. I'm sorry, sir. I'm having a hard time hearing you. I don't know
okay.
if you could put
Okay,
the,
give me 1 second. Sure. Give me 1 second. Let me
thank
turn my
you.
Bluetooth.
Thank you so much.
Okay, can you hear me now?
Yeah, that's much better. Thank you so much. Yep.
Okay, great. And so let me see. Now I can't hear very well. Let me see. Is that okay? And so I haven't had any problems with the agency that I work with
Mhm.
necessarily. I am a 1099 contractor with them.
Mhm.
My problem has been with the state itself because I have one client who is Medicare. It is actually my mother. As I've said previously, if it wasn't for me for my mother needing care, I honestly don't know if I would be in patient care tech
Mhm.
because it's just from what I've heard and from what I experienced with senior leasing. I was in senior leasing, and there are just a lot of issues that seniors may have that that you're not able to help them with, and I believe that it would be um it just wouldn't be a good fit for me because
I'm sorry, Kalia. If you don't mind me asking though, you said you work for an agency, and if so, do you get any good displays or of recognition or appreciation or respect from them?
yes, for the most part, but for yes, for the most part, but also they treat me as an independent contractor. I have 16 hours with them through the state.
Mhm.
And so yeah, I don't have necessarily any problem with the agency necessarily. It's just yeah.
Okay. All right. Thank you so much. I appreciate
My
it.
my pleasure.
Yeah, so I'm gonna let Cynthia, if you don't mind, I think you're ready. Thank you so much.
All right, thank you, Meg. I do apologize. I was just pulling up my notes. So yes, when it comes to respect with the employers, they do provide, our office supplies like gloves and our wipes and our hand sanitizers. For birthdays and Christmases, they give us, $25 Amazon gift cards. So that's like $50 a year. But to me, it's still not enough because, um, when the client needs you, the client needs you. But when you get there
Right.
and they have roaches and mice and it becomes an uncomfortable situation, and I don't know like what to do because I'm not the person that's just going to leave right off the break. But they don't inform you of these conditions. You just get there and these will be the conditions, and you don't want to let the client down. So I stay and help. But then when I leave, I'm like, wow, is there anything else the VA or Medicare could do to help them clean their house so we can feel more comfortable? When we get there, it just seemed like we're just the body, like we're just here. Like, oh, you're available, just go over there. We're not going to tell you what the situation is. We'll give you the care plan and things like that. But, that's just the con for that. But the pros are that they supply you with supplies and, gift you a gift card here and there for Christmas and your birthday.
So Cynthia, it sounds like you could do with more support from your employer, perhaps, with regard to dealing with clients with those issues with clients.
Yes. And just let us know, the situation so we can feel comfortable when we won't get there. And then, because other people have turned the guy down. I had a client that his house was, infested, and I'm talking about like I didn't bring my pocketbook, I didn't drink anything in there, I didn't do anything in there but help him. And as soon as I finished, I left, but he needed me. And he said everybody left every time they came. So I stayed for a week, helped him clean up and everything. And I gave him that much time and I just left. But yeah, support from the employer would be more appreciated for me.
So did you tell your employer about this? I assume you told the employer about the situation, and then was there a response?
Yes, it was. It was a response. It's just like, okay, we just won't put you back on that schedule. That's the response. Because
Okay.
I was also sent to a house where the guy stay in the basement and his sister got the upstairs and he has the basement, but the whole entire basement smell molded. Once again, they need, smell like mildew and mold. So once again, they need you and you're there like, oh, I gotta still clean him up and stuff so he can get where he gotta go because he had an appointment. So I was like, you gotta smell them fumes through your mask. You got a whole face mask on and you still smell it. So once again, that's an uncomfortable situation. So you don't want to get there and hurt their feelings because they need you. So I stay and I just don't go back.
Thank you so much, Cynthia. I appreciate it.
But that also, Meg, backs up the part that we're just a body. We're just a body. That's just who we are when we out here in these home care positions.
I've heard that before. That's not the first time I've heard that, sadly. So I'm sorry to hear that.
But you're welcome. Thank you for allowing me to talk.
Thank you so much. So I'm going to go to Heather, if you don't mind. Heather is with Copper Ridge Nursing and Assisted Living. And if Heather, you could talk about what Copper Ridge, the sort of programs that you've put into place or are putting into place to help and to ramp up respect and appreciation.
Can you guys hear me okay?
Yep.
Okay. So yes, I'm Heather. I'm the assisted living manager at Copper Ridge. I'm actually fairly new here. I started 3 months ago. And during those 3 months, we've had to kind of rebuild. When I first started, things were very messy. The staffing there's big shortages. There was a lot of burnouts. So when I came in, I sat down with my staff and I explained that I'm here to help them. Like Rachel said, I'm no stranger to getting on the floor and helping them at all. Just the other day, we had a resident who required assistance and the other staff were helping somebody else. And I went in and I helped them myself. I love getting on the floor with the residents. I would never say, oh, let me find you somebody else that can help you. That's what I'm here for. And it helps to show my staff that I appreciate them as well doing that. Sorry, I have all these notes. I'm looking to make sure I'm not missing anything. But right now what we're doing is we're developing a positive environment for all of our staff members. When I came in, the staff had a lot of attitude. They were upset. They felt they weren't being acknowledged in any kind of way. So what I have put in place right now is we do mandatory staff meetings. It gives the staff a way to sit down together, collaborate, figure out what's working, what's not working, and working as a group. So we're doing that, and that's actually been very positive. The teamwork has increased. Everybody comes to work on time now because everyone would show up just like whenever they wanted. So now they show up on time. They love coming to work, and it's such a nice, positive environment now. I love coming to work here every single day. I love it. Even the management. So management, the acknowledgement on that, they feel acknowledged. So before when I started, assisted living is linked with a nursing home. So of course, they're two separate things. So they felt that they weren't getting the acknowledgement that they needed. So when I came in as a manager, I showed them that, and now everything has been running smoothly these last 3 months. We've made very positive changes here.
And would you say, so I presume then, do you see a direct correlation with retention perhaps?
Absolutely. Absolutely. Yes. So when I first started, there was barely any staffing here. We were using a lot of agency, and anybody who hears agency, I'm very appreciative of everything you do. I know it's not an easy task coming into a new building, not knowing our residents and what you're supposed to do. But now that we have the things in place, we've been able to hire more staffing, and we have a full set schedule now on all 3 shifts, and we're completely full.
Congratulations. That's great.
Yes, it's a nice feeling. It is a nice feeling.
I'm sorry, go ahead. No, go on. I don't want to, go
Oh,
ahead.
I was just saying for like different ways to like for my staff to show appreciation to them. We the acknowledgement of it is we make sure we celebrate their birthdays. We celebrate Christmas for them. Even if it's just something minor, it's the acknowledgement of it. I had one girl, she had worked so hard in the 3 months that I've been here to change things around. And I gave her a gift card to show I appreciated her hard work. It wasn't nothing major, but the fact that I gave her and I acknowledged that meant the world to her. She actually hugged me and cried. It was like kind of emotional day for her, but it was nice to see
Wow.
the difference in her.
Wow.
Yes.
Thank you very much, Heather.
Of
So in the
course.
in the interest of time, I'd like to move to Nate and endurance. Sort of, you guys could talk. I would like Nate, if you don't mind, talking about what the Sika Foundation does, and then what you did for with Edenwald and endurance and Jackie.
Well, thank you, Meg. And first off, I think obviously this conversation is important for a variety of reasons, but the most important part here, with all due respect to Elnaz and Heather and myself, is hearing from the folks who are doing the important work, honestly. Cynthia, Reba, Kalia, Rachel, thank you for, again, using your voice to tell people what you want, because I tend to be the type that says when somebody says what they want, you believe them. And I think it's really important to get the feedback from the people saying, this is what I'm looking for. So I'm president of Sika, which is basically the Celebrating Caregivers Foundation. We're a nonprofit here based in Washington, D.C., but working around the country with organizations, including Edenwald and Jackie and Endurance, who are on the call. It's just great to see you. We got to spend a really special moment with Jackie and Endurance and the Edenwald team. They partner with us on a recognition program for their team members. Something that they showed they wanted to bring to the people who work for the organization and invest in saying thank you and being grateful. And Jackie was selected as one of our national award recipients. So, just a few weeks ago, I got to go up to the Baltimore area and join them for a recognition celebration where we gave Jackie some a trophy and some other things to show our appreciation as a community organization, a group of people who lives in the community that you're serving. And my goodness, I mean, again, the best part of what I get to do is to come and celebrate folks like Jackie. And worth noting that the recognition Jackie received was from a resident there, a family member who had come to visit. But the reason we heard about it is that Endurance took the time to write out the story about what happened. So I know that Endurance is somebody who does that for a lot of her team members, but it goes to show how much taking those few minutes to share the story about something they saw, something that somebody did that made a big impact in somebody's life, I think was just, again, exceptional as well. So really happy to see the two of you here on the call. And again, we just love what we get to do, which is celebrate care workers in a meaningful way. And I'm happy to talk a little bit more about it here, Meg, but I want to make sure that we turn it over to Endurance and Jackie as well.
Thank you. So Endurance, if you don't mind talking about a little bit your experience with Sika and what else that you do with Edenwald to help to recognize and appreciate your direct care staff.
Okay, good afternoon all. My name is Endurance Theophilus, and currently I'm the unit manager of the memory care unit at Edenwald, a HORICOM. I started Edenwald as a GNA. And so when I hear other GNAs voicing their opinion, I actually know what they're talking about because I've been there. Started as a GNA, moved to becoming a CMA, giving medication, became a nurse. I worked as a nurse in our skid unit for a while, almost 2 years, before I got promoted to this position. Now, knowing the feelings that you have when you're on the floor, as a manager, I don't just sit in the office. I come out, and as Heather says, I go to the floor and I assist them, up to the point of even assisting the GNAs giving water, helping them go to the bathroom if the genies are not available. So that gets to let your team know that you are not just the boss, but you are a team player. And it goes a long way for them to listen to what you have to say. One great thing I've done with my team or my unit is to make sure that I do huddles with them. So I gather them together and we discuss. We talk. I also allow them to air their views and not just me dictating everything to them. And I know somebody mentioned about when there is no forward, giving incentives. That is a very good way of letting your staff of each of the shifts know that you appreciate them when they are putting the safety of these residents as forefront. So we do that as well. I call them and I say, day shift, no for this time. I really appreciate what you all do. And sometimes when a family member comments any of them, I call them and I let them know. And I go to an extra length of even buying little things and giving them as an appreciation. So that is a great way. The Seeker Award is a great award at Edenwood. Every member of Edenwood is a family. And so up to housekeeping, every one of them receive, the award. And so we take great advantage of that. We recognize our staff whenever there is somebody gives good comment about them. Like, oh, I was just here and Jackie did this or did that. Something extraordinary. So we write it down and we send it to HR, and then they show their picture. As soon as you walk in, we have a slide that shows all the Seeker Award winners with their pictures on it. So people walking by will look at it and see this picture, so they feel appreciated. Speaking more on Jackie's award, Jackie won the first Seeker Award. I think it was a month before she won the national. For the first one, she talked a little bit about it. A family member came to visit, just touring the unit. They like to tour the unit because it's a brand new unit that was renovated to help the resident with Alzheimer's disease and dementia, to have a free way to move around on the unit. It's a pretty unit. So people come in and they tour the unit. The impact they get from the staff goes a long way to show what kind of care we give to our residents. And so Jackie, on that very day, happened to, with all smiles, introduce herself to this family member who is a visitor. It's not even a family member. It doesn't have nobody here, but a visitor who came in to talk. She introduced herself, showed them around, like she told them around the unit, and the family member the visitor was surprised, like she doesn't know me before, and she took interest in me. So that was what gave her the first award that she won. The national award, just getting proud to that time, a family member was touring the unit to bring the wife to memory care unit. Tough decision for him. He thinks he's not doing the right thing because he lives here too, in independent living. And immediately the day he came to tour, he came into my office and told me, there was one of your staff I saw on the door, and as soon as she saw me, she said, oh, hello, introduced herself to me and my wife. My name is Jackie, and we are so eager to have your wife come in here. We can't wait to meet her, So he was really happy with that introduction, and then he came in and he told me about it. And he couldn't remember the name, but he described the uniform that Jackie had that day. And of course, I knew it was Jackie. And so I said, is it Jackie? And she said, yes. So when the national award came in, I included that and included the first interaction she had with the visitor. And of course, Nate took interest in that. And that was how she won the award. She didn't just do it just because of the award, but that is who Jackie is. That's her personality. She's very loving to the residents, takes them as her family. And so are my other staff who also work here. I have great staff here. They all work together as a team. My day shift, they are superb, I could say that. So recognizing them is very, very important. Another way then we'll recognize their staff. We do have holiday bonuses. These holiday bonuses, they give every December. I could say, I don't think any other places give as much as Edenwood gives. Because somebody can get up to $500 as your holiday bonus. So which is great. So that makes the residents, the staff happy when they receive that bonus. And they also have their Christmas holiday and other holidays that they celebrate as well. So it's very, very important that when staffs are working, recognition and respect helps them to put in their best in taking care of these residents.
Excellent. Thank you so much, Endurance. That was fantastic. I know it's 1 o'clock, but if some of you don't mind staying, we'd appreciate it. I would love to hear more from Nate. If you could talk about your experience over the years working with SECA and what you've seen, how you've seen that the recognition perhaps maybe correlates to recruitment and retention and how it impacts the workforce.
Yeah, thank you, Meg. I mean, again, I don't know if everybody else felt the same way, but getting to hear Endurance share that story, it puts a big smile on my face. It makes me want to be better. And again, taking the time to talk about it is really important. I did have a few slides to share. I don't want to be that guy, but I think I want to kind of outline why, for the people on the call, recognition is something that is worth investing in, is worth thinking through. And our sort of philosophy with SECA is that we want to make recognition accessible to people, make it easy to do so that more people recognize and say thank you to one another, but we want to make it more meaningful as well. So, there's an element of making sure that people know where to go to say thank you to one of the staff members, but also to use what we refer to as the science of recognition. It's not as sterile as it sounds. It's like a lot of research has gone into what motivates people, what makes them feel good about what they do, and sharing that and implementing it in the programs like the one that we run with Edenwold. So first off, again, when people tell you what they want, you listen to them. And clearly it's worth acknowledging that when Meg showed that first slide, fair compensation and enough people to support the care that people need to provide were the top two. People deserve to be paid fairly and supported by their organizations. But right after that is recognition, feeling appreciated, and a culture that says we value what you do each day. And you see it here. People who work in this industry do it because they want to make a difference in people's lives. This is not to say you should pay them less because that's where their heart is, but they place value on knowing that they make an impact on somebody, and that recognition becomes really important to them. So, even more important that you do it. I won't go too deep into this one, but I think it's also worth acknowledging that not everybody receives recognition and appreciation the same way. The lady Meg had a slide from NACA about, again, the importance of recognition. I had one of their board members tell me directly, the only recognition and appreciation that I really crave or believe is from other CNAs, from people who do my job and then acknowledge that I'm doing it well is really important. So you got to be inclusive in the way that you allow people to recognize one another. If it's just your leadership team or if it's just managers that you're expecting to do all of the recognizing, you're cutting out 75% of the team. And so you got to find ways to allow them to say thank you to one another in a meaningful way. So, you see this graph on the left. If you're going to take a guess at what's most important to somebody, recognition from the very top person or recognition from a peer, you're going to be wrong more than half of the time. So you got to kind of know the people and ask them the questions as you're onboarding them. Say, what recognition do you crave? Is it, who is it going to be from? And again, allowing everybody to recognize one another. And then if you're familiar with the 5 love languages, it applies to the workplace too. Languages of appreciation in the workplace, words of affirmation, just that positive reinforcement, verbal or written, is really important to people. Almost half of people say that's what they want. I'm a quality time guy. Getting to spend time with somebody who's invested in my success and the success of an organization is really important. And Rachel had a great example earlier of having her manager come in and do something and work with her on it in an act of service that showed she wasn't willing, she was willing to get her hands dirty and do the stuff that needs to be done. Only 1 in 20 people say that a gift is what they really want to be shown appreciation. Now, that probably makes 19 out of 20 people liars because we all like gifts, but it doesn't have to be, an extravagant, big thing. It just needs to be meaningful. They want to see that you know them. And again, if you're giving somebody a gas card and they don't have a car, that's not going to land too well. You got to know them well enough to be able to give them something that means something. And we joke that, give away a rubber chicken, just something that says, you had an excellent idea, just make it fun or funny and show that they are on your mind, I think is the most important thing. And we've talked a lot about stuff that people are doing, and I applaud all of it. It's all important. But there's different ways of looking at how you're showing appreciation versus recognition. And again, they help you achieve different things. Employee appreciation is stuff we all get: staff parties and events, barbecues, that slice of pizza that Reba mentioned earlier, holidays and birthday gift cards. This is something everybody gets because they're part of the team and they're great for building teamwork. But they aren't the same as recognition, which can also take different forms. You got your tenure and years of service, employment-based or employee-based, thank yous. Again, this stuff can be impactful, but it's not really exactly the same thing. I think what people most crave is what we call caregiver recognition. It's not just acknowledging milestones, it's building culture, it's sharing stories, it's talking about what's at the bottom of the heart and not at the bottom line, and engaging people. Reba said, can't just be another slice of pizza dropped in the break room. Now, if you're given the pizza and you're hanging around to talk to people and listen to them, that's much better than just, again, throwing it in there and say, have at it. We need to stop focusing on people's stomachs and start focusing on their heads and their heart. And so again, I think the storytelling, like Endurance was able to do there with Jackie, becomes really meaningful. I don't want to dive into this, but again, as an idea about a framework and the science of recognition, there are things that you want your coordinated recognition efforts to look like. You want them to be inclusive. Anybody can be recognized on your team, no matter their job role, and any stakeholder from patients, residents, families to other team members should have the opportunity to say thank you. It needs to be mission aligned. I think it was mentioned early on. If you tie that stuff back that you talk about in onboarding, Elnaz, here are our values. Well, we're recognizing you for compassion. We're recognizing you for teamwork, and being able to say, this is what we're about, and you're an example of it, is really important. You got to make it public. We got to very publicly celebrate Jackie at Edenwald, and I get to go to these things on a frequent basis, and whether it's a surprise to them or not, you get a chance to talk about what happened in a big audience and help people connect the dots, why it's important. Ultimately, though, the most important one here is that it's authentic. Again, an authentic gift, the gas card to somebody who doesn't have a car you're giving it away, immediately. You want to say who did what for whom and when it happened. Be very specific about things because it shows that you're paying attention. It's not just, hey, great job today. And it's like, well, do you even know my name? And what did I do that was so great? Just let them know exactly what it is, and that is authentic. And you got to do it consistently and in a timely fashion. Don't leave it for the end of year annual review to say, hey, thanks so much for pitching in at the Valentine's Day party in February. If that person's still around, they may have forgotten exactly what they did for the Valentine's Day party. Tell them that week, tell them that month, make sure it is in a timely fashion and that you do it throughout the lifestyle. As everybody knows, the first 90 or 100 days in employment is critical. If they don't feel at home, if they don't feel cared about, if they don't feel like they're being recognized when they do great work, they're not going to stick around. I know I wouldn't. And then I just will drop this in here because when you build programs that focus on those things, this is what we try to supply our partners with: accessible recognition based on the research. You get incredible impacts on employee retention, which gives incredible impacts on the quality of care provided to people The longer that they're there, that they know the way you do things, they provide better care, they provide safer care. So when you get people recognized, they not only stick around, but they do a great job of caring for people because you're showing that you care about them. And ultimately, that's what this is all about. We're in a people business here. So appreciate Meg you letting me do that. And I know we ran over here, but I hope I'm always open to a conversation if you're looking to do something new or fun or looking for a partner in recognizing your team members and making it meaningful. I'm always available. So thank you, Meg, for allowing me to join.
Nate, thank you so much. These are really great slides, really great information. And I hope that maybe you could let me share them along with my slides after the.
Yeah, I'll send them over.
I would like
Yay,
to.
Nate. Yay, Nate.
Mhm.
Yay.
Thank you.
Can I say something really, really quickly?
Sure.
I'm an independent contractor, so I don't necessarily have these situations with the agency. But I do have personal care assistant friends who had problems with transportation at some points, right? Especially, okay, so like when COVID was around, we were all the essential workers who were the heroes, right? We were the essential workers that were the heroes, right? So yay, wonderful. Meanwhile, like upper management was home with their family, while we were giving care, and we had to stay you know, as healthy as possible. And a lot of my friends couldn't even get on the bus because the bus wasn't running, right? And so another way, as Nate was saying, if you give a gas card and the person doesn't have transportation, like that's, maybe it can, if you do know your employee, I'm sorry, and they, if you would have, maybe a Uber car instead, you know,
Yep.
that's a great idea. And also with client care, there are a lot of like knots and shoulders, right? Maybe, maybe a massage, right at in the agency, at the care facility, so
Yep.
I just wanted to throw that in there. Thank you.
Thank you. Thank you so much. Cynthia, you wanted to say something.
Yes, I know I came in a little late, but I wanted to touch bases on the first question about my opinion, in reference to the employers honor and appreciate direct clear professionals so that they can want to stay at their jobs. I've been in this profession, July be 3 years. I just changed my profession 3 years ago. I used to do mortgages and collections and stuff like that. So this is like new to me, but I always like helping people. That's customer service was like a big thing for me. So I think that if they keep us updated on different training options, like keeping us updated on the healthcare industry and the changes, hands-on skills to improve our care, help with financial classes. Sometimes people be stressful at home, but they still put that game face on to come to work. You might can have some stress management classes, specific guidance on helping people with their health conditions. Like I was using the example like COPD, like, a lot of us don't know the real education about some of these illnesses. So we get like some type of, classes about that person because we had that person for 2 years. And if anything happened in case of emergency or what's expected, how to clean a ventilator, anything like that. We never see each other. So I think monthly meetings would be a great when you work at an agency because we don't see each other. We just, put our, we use the phone and that's how we set up our appointments and stuff like that. So it would be great to have those monthly meetings to meet other agency workers so we can learn from each other and help each other take care of their patients. So say for instance, if someone is off and they are used to that person, but they know someone a better fit while they off, we can call that person to come help and fill in while we're off. some, a little incentive for overtime and travel. When you drive from one county to the next and you get there and the client didn't know you were coming, but the agency didn't inform them, but they told you to still go because you're on schedule. But you get there, because I do VA transportation for like their surgeries, and I drop them off at the hospital. And sometimes they change the appointment, and I get out there and they don't call and say that they changed the appointment. So I didn't waste my gas. So I have to go back home. So just keeping the home care worker more informed, and more informed and giving more information, and sometimes doing regular raises, because the cost of living is rising, expeditiously, and home care workers simply can't survive on the wages. Employees can show respect by giving wages and conditions for us to live substantially. So I think, giving us raises here and there, also because we've been with them over 2 and 3 and 4 and 5 and 6 years. But that was just something I wanted to put in and say, because I
That's very
came in
important.
late. Thank
Oh,
you.
I'm sorry. Thank you so much, Cynthia. That was very important, I think, incredibly useful. We, as a matter of fact, next month in April, our next webinar in the series is going to be focused just on home health, and the employees in home direct care staff in home health. So we will let you all know about that. And I think a lot of these, what you were talking about, is related to that. I also want to give a shout out to Sharon Ward, who's been sitting. Thank you so much for joining us. Sharon had some really great points. She was on our last webinar, and she really had some great points about respect and appreciation. So I'm so glad that you joined here, Sharon. And if we had more time, I would ask you to talk, but we are way over. And thank you so much, everyone. I'm going to send the presentation out to everybody and the recording as well. And I just want to say thank you again so much, everyone. Take care.
Thank you.
Thank you.
Thank you, everyone. Have a great weekend.
Bye.